term, traumatic brain injury. Is that the same thing as a concussion?
Well, often the terms are used interchangeably. So concussion is considered a mild traumatic brain injury.
And is it more prevalent in teens and kids, or is this something that affects all ages?
It affects all ages. Kids or teens seem to be more susceptible to brain injury, maybe because their brains aren't as well developed.
So is that something you see? Is it just brain development, or is it, I don't know, more sensitivity to that?
Oh, they're more sensitive. They have less cognitive reserve, so their brains don't really have the capacity to suffer concussion as well or recover as well as adults would.
This concussion, is it something that affects a child more because it's still developing, like you said?
Well, clearly it affects a child more. We realize that. The reason for the concussion, like you saw in the cartoon, is because the skull is a rigid, fixed structure, but the brain can still slosh about inside the skull, thereby causing all the events that occur in brain dysfunction. So concussion is a traumatic disturbance of brain function because of the movement and injury to the brain structures.
What injuries? Let's talk about that. I think that's important to know. What injuries cause concussions? We talked about motor vehicles, maybe some falls. Elaborate on that a bit.
Well, I see all comers, certainly recreational activities, football, lacrosse, activities like that. In the workplace, we see a lot of falls, things falling on people's heads, motor vehicle accidents, falls. Certainly we see at the hospital, people fall and will have a concussion. So I see it in many different realms of society.